Hi, my name is April RedHorse, and today I'm going to be going over mental health and psychopharmacological interventions. I have a scenario as well that I will be working through. To begin with, we have our scenario. The Emergency Medical Services team has brought a 54-year-old patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. There are several key points here that I will address thoroughly. When a patient presents to the emergency department, assessment begins the second a nurse lays eyes on them. Whether they are brought in by ambulance or walk in on their own, a nurse is constantly taking stock of what could be going wrong. The response that I give to this given scenario will be explored. Mental health treatment, increasing rates, and insurance coverage will also be addressed. From the presentation of the patient, my first thoughts would be lithium toxicity, dehydration-related delirium, or another type of delirium. The fact that the patient is asking for a bottle from the staff indicates that she recognizes she needs to take some sort of medication. She seems to be unsteady, which led to her fall in the park, and the state of her clothing could indicate that she has been suffering from this for several days or that she is indigent. The short-term health risks that I would be concerned about would be heat injury, dehydration, and any other injuries she may have sustained from her fall, such as a facial fracture. The long-term risks, I suspect, would be lingering effects due to lithium toxicity, such as renal failure or aplastic anemia, as well as the possibility of malnutrition. Jane Doe's shaking hands, as well as her confusion and combativeness, can be attributed to several different things. The first thing that stands out is the possibility of lithium toxicity. Severe lithium toxicity can cause memory deficits, Parkinsonism, and psychosis, and the symptoms of which would align with symptoms of this patient. In order to assess what is going on with Jane Doe, there would need to be several different tests that need to be done. First, blood work to check the patient's overall health, such as a metabolic panel and complete blood count. This helps us to rule out infection or electrolyte imbalances. In addition, a drug screen and serum lithium concentration should be ran at the same time. Knowing if this is lithium toxicity is key, and also having information on any other medications Jane may be taking will help us form a plan of care. If a urine sample can be collected, running a urine drug screen as well as tests to check the function of her kidneys would be advisable. In relation to mental health and how it has been accessed and the growing issues behind it, I have found several things. There was a study done in Sweden that found that there was a 2.9% increase in the utilization of mental health care between the years 2011 and 2017. This information indicates that there will continue to be a higher demand for treatment for mental health disorders. In the treatment of mental health disorders, there are many different modalities that can be utilized. Most commonly used is psychopharmacology, seeing as antidepressants were prescribed more than any other medication. Often, psychopharmacology is used in conjunction with psychotherapy, such as cognitive behavioral therapy. Cognitive behavioral therapy is the use of collaboration between the patient and the therapist to focus on the direction of efforts to change how they respond to a stimulus. And it uses other research methods that could be used as well instead of the initial response to the stimulus. When looking at how insurance benefits pay out in order for patients to receive psychotherapy as well as psychopharmacological therapy, the hope would be that it's getting easier to get the care they needed. Unfortunately, those who have mental health conditions that are worse and may require more treatment have found that it's harder to access the care that they need. The situations where the patient's condition is not that severe, they are able to get the care that they need easier. than those with more severe cases. With an increase in mental health disorders, there needs to be an easier way for those who need it to get adequate mental health care. With the enaction of the Affordable Care Act in 2010, there were provisions set out to help increase the availability of mental health services. Information was gathered regarding how much improvement was made with this mandate, and it was found that some progress had been made. Large steps have been taken in recent years to try and bridge the gap between mental health treatment needs and mental health treatment. The addition of the extra coverage mandated in the Affordable Care Act has helped, but there are still ways to grow. Increasing the knowledge of treatment and destigmatizing getting treatment can help patients get the care that they need. It has been demonstrated that destigmatizing mental health and increased knowledge of treatment options can lead to an 18% increase in the initiation of mental health treatment. The importance of understanding both disease processes and medication side effects cannot be understated when going into healthcare. The number of things that can affect how a patient presents are limitless. Having a good grasp of mental health treatment is essential as well, so that all systems can be reviewed in the treatment of a patient. Due to the increase in mental health rates, it becomes even more important to be well versed in the symptoms of illness as well as drug interactions. Any references that I used for this paper or this video will be in the description below.